We are studying algal blooms in Florida, and the reason that this is important is because we all like to live, work, play in our environment, and we'd all like to know about the water quality and whether or not we can be in the water when there are algal blooms. The human health outcomes exposure to environmental toxins aims to study the relationships between blooms and the human health outcomes, such as respiratory, gastrointestinal, skin issues, and perhaps liver issues. So we have the water specialists who sample the water, and they're looking for the presence of microcystis, which is the toxin. We do the same for air sampling at the same time in the same area. Then we do the human sampling, which is the blood samples and the nasal samples. And we send our samples off to a very unique lab to help us determine whether or not there has been any potential exposure.
So the main reason we're doing these is trying to see how deep microcystin and other harmful algal bloom toxins can, cause respiratory distress in humans. So they're impactors. There are 9 different layers. Each layer is different size whole particles from the top. That kind of helps represent the different layers of our lungs, are those different size holes. And then from every layer and then on, there are these Wattman filters that help absorb the particles and the toxins themselves that are getting aerosolized.
The University of Central Florida College of Nursing is collaborating with a very large group of people, experts in this science. We have other universities. We have vets from across the country and epidemiologists. So our nurses are working with this data to look at symptoms. And with that, we're able to have a better idea of how our community members are responding to the presence of algal blooms. And they're also going to be working with some cutting-edge technology coming up in the next cycle that will tell us about their respiratory status. So One Health underpins this research to help us understand more about how we interact with our environment, especially here in Florida. This is a unique environment, and how we are influencing the environment and how the environment is influencing our health. And to do that, we need nurses. Nurses are the people on the ground. They're in the community. Nurses continue to engage in the community beyond the clinics and the hospitals. Nurses know how to ask the right questions. They know how to interact with the community. And we just believe that nurses need to lead this research. The University of Central Florida College of Nursing HHOT Lab engaged in this research to better understand the implications of harmful algal blooms, or even any algal blooms in Florida, and to let people know when they need to be more cautious.